So I spent some time thinking about actually what are the issues and risks and some of the crisis points in terms of drug and alcohol treatment in the community, actually, to specify. So we've got dipping successful completions, we've got increasing drug-related deaths, which we know about. The treatment budgets are reducing. I think access to treatment for alcohol clients is poor. And it's something that needs to be addressed as a matter of urgency. And earlier I referenced around, obviously, the alcohol levy, and I think that possibly is one solution in terms of funding. I think I left the drug and alcohol sector for about 3.5 years. And when I left, people used to talk about dual diagnosis, and they used to say, well, if you experience dual diagnosis, you can't get access to services, you get bounced between the two. I've come back 3.5 years later, and we're having the same conversations. That's something I think we really need to get a grip of. You know, there is areas where there's good practice, but for me, we need to change our behaviour. We need to understand between NHS providers, voluntary sector providers, why does this keep failing, and address it. One of the things, which is very close to my heart, and obviously close to the Alliance's heart, is a subgroup of the Alliance has established itself as it's the NHS inpatient group, and they've come together as the 5 remaining NHS inpatient units in England, because they are estimating by 2020 they don't think any of those will be left. Now, these units serve the most vulnerable and the most complex clients, and for me to have a scenario like that, to allow that to occur, in my view, is something we really need to avoid. And I think there's work going on to try and address that, and the group is working together and meeting together at lunchtime to discuss that work. But for me, that's potentially a crisis we face. We've lost expertise. I think in terms of our workforce, an impact of diminishing budgets has been that actually training the workforce and training we offer the workforce has lessened. And so I think that our workforce deserves better. So I think we need to change how, as a sector, we respond to that, and how do we train our recovery workers? How do we train our peer supporters? There's a decreasing number of addiction psychiatrists, and at the moment I can't see there's a sustainable plan to address that. Again, there's work going on about this, but I can't see how we're going to address that. I think there's a target of around 60 addiction psychiatrists across the country. I'm not sure about how many we've currently got, but that number is reducing year on year. And actually that loss of expertise is significant. The other thing I want to draw attention to is, in preparation for this, I've spoken to a lot of small voluntary sector providers, and just to understand the challenge for them, sort of as organisations which often grew up from communities, provide services in those local communities, have been there for many years, about trying to survive in the environment in which we're in. And all of them said to me, it's incredibly difficult, and we are losing lots of small local organisations, which I think has an impact on how they're connected with the community, but also it loses lots of value, and I think I'll go into that in a moment. And I think the group who quite often get missed is commissioners. It's sort of one of my other jobs, or the job that pays the bills, is, I am involved in a lot of the sort of commercial work for inclusion and tendering. And what I've observed is, as local authorities have had to make huge budget cuts, the number of commissioners has reduced. I think the remits that commissioners have to deal with has extended massively, and we've also lost expertise there as well. And for me, all these factors coming together, conspiring together, actually create what I think is this isn't happiest talk ever, but quite a bleak picture. But often I think we see it as separate challenges. And I think we need to start thinking of things more in the round, and actually think about strategy as what is a very well-equipped and, in many ways, resource sector to address this.